No worries. So,
You want me to
good
name myself?
afternoon and welcome to the session on the topic Indication and Scope of Cosmetic Gynecology. We are glad to have Dr. Monica Agarwal among us today, a senior consultant Apollo Cradle Hospital, with us to take the session and to show us all the details and to tell us about the topic in detail. So I would share my screen with ma'am and would ask her to take the session forward. Over to you, ma'am.
Yeah, thank you, Nikita. Hello, everyone. I'm Dr. Monica Agarwal. Today, we are going to talk about scope and indication of cosmetic gynae. So, starting with my topic today. See, whenever think about a gynae, what comes to your mind, you may think that she may handle my pregnancy, she'll deliver me, she'll help me in my delivery or a C-section. If bleeding related issues are there, she'll help me with the treatment options. She can do a laparoscopy for me. She can do a hysterectomy, and if I'm not able to conceive, maybe she'll help you with infertility treatment. She can do a DNC for you if you want an abortion. But so far nobody thinks about what are the scope, I mean, of a gynae beyond a normal gynae, being beyond a laparoscopic surgeon, beyond an infertility specialist. So there is a new generation gynecologist with, known as cosmetic gynecologists. So what they do, they along with the routine old gynae and obs work, we are now doing cosmetic gynae work. That is cosmetic gynecology. So as such, cosmetic gynecology is a misnomer. Why it's a misnomer? Because we are not doing things to beautify your genitalia or private parts. That is also one of the scope of our work area, but mainly we are dealing with female sexuality. Females, those females who are suffering with sexual related any kind of disorders, they are seeking some sexual medicine expert, or for some urine related problems they were going to gyne or urologist for the treatment. We are the persons, like cosmetic gyne is a doctor who can deal the issues from the root cause. So they help you for your intimate wellness. They'll help you regain your regain your confidence, and really it will be a gift for you and for your partner. So whenever females in India, it's considered a taboo to discuss about sex. But definitely, males are very open to all these things. They may discuss about their problems and all, but females, they back out from discussing things. And they then, because they don't discuss about sex, they won't be discussing about their problems, whether they're getting pain while doing intercourse. They don't discuss about their satisfaction part, whether they are getting any orgasm or you while doing intercourse or not. So these are the things which are not being discussed by females with even their closest of friends. So females should come out of this hesitation. There is a platform now. You can go to a cosmetic gynecologist and you can discuss all your problems openly with the cosmetic gynecologist. There are females who pass urine on pressure, like whenever they cough, they sneeze, even while doing intercourse, they pass urine. So we have problems for all these things. Even if you have loss of sexual desires, we have treatment for that. We'll ask you in detail about your history, we'll do counseling, and we can give you the best treatment option available. Desire for sex is an innate human need, and it is the right of everyone to have a satisfactory sex life. As I told, the males, they regularly talk about sex. There is no hesitation on male part, but females, they hesitate in sharing and they take it for granted कि चलता है, females हैं, मतलब अभी I can share with you an incidents where one of the very oldest मतलब old lady came to me, and she was like having a army background. So like she told 10 problems, you know and I only asked one problem: do you leak urine when you cough or sneeze? And you know what was her answer? Yes, it's a normal thing to happen with females. But the thing is, you know, she had to be counseled that this is not a normal problem. This normal thing to happen with females. This is an issue which can be tackled if, like, she would have come on earlier stage without any surgery or something like that. We have treatment options for that also. This is like, uh, husband is in mood to do the thing, but female is just sitting on the side, there is no mood. But now we have, problem, we have solutions to all such kind of problems. You can come to a cosmetic gynae, you can share everything in detail, like, at what part of your sexual cycle you have issues, whether it's the arousal part, whether it's the orgasm part, whether it's the in between part. So we lubrication thing and all, so we can deal with any of your issues. Like, we go to gym, we do exercise and all. So sex is also a complete exercise in itself. How? Because it's a complete exercise, complete cardiovascular exercise. It will help you in lowering your blood pressure. It boosts your immunity by increasing the production of IgA, which help you in raising your immunity. You release a particular hormone known as oxytocin, which help in getting an emotional bond to your partner. Being an exercise, you burn calorie, you sleep better, and there is hormone involved known as estrogen, which make you feel younger also. And because it's a kind of exercise, it helps you in regaining your lost pelvic muscle strength. So it makes your pelvic floor muscles strong. So those females who have incontinence issue, those who have leakage of urine while coughing, sneezing, उनको भी ये काफ़ी help होता है if they are doing sex on regular basis. And definitely, being have sharing a great bond with your partner and all, you get psychological and emotional benefits also. There is a term known as hypoactive sexual desire disorder, where there is loss of sexual desire, and it is one of the most common form of sexual dysfunction. And it is caused by a combination of both mental and physical factors. So we do counseling also, like, at what part of sexual cycle female is suffering. And it's the quality of a sex life which matters, not the quantity. So, how a cosmetic gynae can help you with your unsatisfactory sex life? So, these are the problems which can be dealt by cosmetic gynecologists. I'll be taking one by one. First, I'll take the legs vagina. So, most of the females after normal vaginal delivery, they complain of looseness of vagina. So, what happens? The female and the male partner, they both are not getting set whenever their sexual activity resumes. I mean, because of laxity, female is not getting the feel of the male organ, and even male is not able to perceive the tightness which should have been there. So this leads to a lack of sexual desire also, because once you are not getting a proper sex activity, you are not attaining orgasm, a vicious cycle happens that you tend to lose your interest also. So female loses interest, male loses interest, and this leads to frustration. So we have treatment for that also. And if you are not attaining orgasm during sex, orgasm happens in females from two places. Like, we have clitoral orgasm and we have vaginal orgasm. Vaginal orgasm happens through G spot, which is a neurovascular bundle in a female vagina, which help females in getting orgasm. And some of the females, they get orgasm through clitoris. So the whenever you come to us, we can deal with your problems. We have treatment for this. People are aware these days that we have orgasm shots also, to make your sex life complete and healthy. Then there is loss of libido. Again, the counseling part can be done, and reason for that can be, we can ask. Vaginal dryness is again one of the main problem. That is because of, I mean, post delivery this happens, and in old age this happens. So we can deal. We have modalities available with us which can help you. Along with hormonal supplements, we can offer you those modalities, and you can deal with vaginal dryness, painful intercourse, we have modalities for that. Then there is a minora along these are the problems with the female, outer genitalia. We have labia minora, we have labia majora, and prolapses like something coming out per vaginum. This usually happens after difficult delivery, like if the lots of pressure is put while make delivering the baby out. In later age, after few years, female may complain that something is coming out of my vagina. So these all can be dealt by a cosmetic gynecologist. काफी टाइम से ये सब प्रॉब्लम्स डील नहीं हो पा रही थी, because a normal gynae cannot do a labiaplasty for you. She cannot do a preputial fold reduction. Prolapse surgery normally हम लोग like as a normal gynecologist भी करते थे. But now cosmetic gynae have cosmetic gynecologists are dealing with all these problems surgically also and through other modalities which are non-surgical. Then one of the important problem is incontinence, यूरिन लीकेज वाइल स्ट्रेनिंग. आप जंप करते हो, आप कफ करते हो, आप एकदम पोस्चर चेंज करते हो, इवन इंटरकोर्स के टाइम पे यूरिन लीक होता है. तो फीमेल्स इसको टेकन फॉर ग्रांटेड लेती हैं कि नॉर्मल डिलीवरी हुई है या एज बढ़ रही है, तो दिस इज अ कॉमन प्रॉब्लम. बट दिस कैन बी डेल्ट वेरी नाइसली. अगर आपको स्टार्ट हुआ है ये प्रॉब्लम, प्लीज कम फॉरवर्ड. अपने अपने गायनिक डॉक्टर को बताइए, या यू कैन विजिट अ कॉस्मेटिक गायनेकोलॉजिस्ट बिकॉज वी हैव मोडालिटीज विच आर नॉन सर्जिकल फॉर अर्ली केसेस. आप अगर बहुत ज़्यादा किसी को यूरिन लीकेज है तो फिर सर्जिकल ऑप्शंस में ही जाना पड़ेगा. बट फॉर early stages we have modality which is non-operative, so this can be dealt very beautifully. This is now, like, things have changed. Even Indian mindset have now started accepting that women also deserve equally great sex life for their overall physical, social, psychological and emotional well-being. Now, coming to incontinence, this is urine leakage while straining. This is a normal pelvic floor, and urinary incontinence is leakage of urine in an activity that involves physical pressure like coughing and sneezing. कि हल्का सा भी कफ किया, स्नीज किया और एक ड्रॉप आपका यूरिन का लीक कर दिया. दिस इज नॉट नॉर्मल, and it can become severe when there is leakage even in regular activities like standing up, bending and even walking. We have witnessed patients जो पैड लगाते हैं, जिन्हें रेगुलर पैड लगाना पड़ता है यूरिन लीकेज के लिए. वो लोग सोशल अपनी लाइफ में इतने लाइक दे सफर लॉट कि वो कहीं प्रोग्राम है, उनकी फैमिली में कोई फंक्शन है, दे हेजिटेट टू गो. सो दिस अफेक्ट्स योर क्वालिटी ऑफ लाइफ. और अगर आप इसको टाइमली नोटिस करेंगे, डॉक्टर के पास जाएंगे, अपना ट्रीटमेंट कराएंगे, तो यू कैन वेरी वेल आप अपने आप को सर्जरी से बचा सकते हो. सो timely intervention and timely consultation with the cosmetic gynecologist is very important. So, what are the causes which cause incontinence of urine? Childbirth, as I said, normal delivery के बाद बहुत सारी females complain करती हैं. Age related problem, menopause हो जाना, aging, obesity is also one of the reason. कोई surgery हुई है, suppose किसी ने prolapse की surgery कराई है, कई बार उसके बाद भी ये precipitate हो जाता है urine leakage. किसी को chronic condition है, cough or sneeze का, then also it happens. So how do we diagnose a patient that she is having incontinence? We tell patient to come full bladder, urine hold करके आना है, full bladder आना है. We make the patient lie down on a couch. We tell her to cough. If on coughing urine leaks, that is a positive cough stress test that this female is suffering from urinary incontinence, which is known as urinary stress incontinence. But before initiating any kind of treatment and all, we have to rule out urine infection, whether she is having any urine infection at the present moment or not. Treatment includes, we tell patient to do some exercise like Kegels, everybody knows, because even after delivery, be it cesarean or a normal delivery, a physiotherapist comes to your room and tells you to squeeze your this urethral sphincter, anal sphincter, so that they start regaining their strength. Because even if you are not delivered vaginally but carrying a baby for 9 months in your womb, because of gravity, your pelvic floor muscles and ligaments they get lax, so pelvic floor muscles have to work very very vigorously to keep you upright and your baby in position. So they also get lax even if you have not delivered vaginally. Even cesarean patients also can suffer from incontinence. So and but Kegel exercise is something which, people cannot do it very frequently, because you have to follow a particular protocol, and it should be checked by the physiotherapist internally whether you're doing it in a right way or not. So it is not practical also. We have treatment for that. Being a cosmetic gynae, we can offer you electromagnetic stimulators. We have laser or radio frequency machines available. And if a patient is having very severe complaints, like she leaks urine all the time, not only on abdominal pressure, but even, like, any regular activity, she is just leaking urine, she has to put a pad even if she goes out, then she becomes a candidate for surgery, and the surgery is known as transobturator tape. It's also minimally invasive surgery, not very elaborative surgery. So now this is like, coming to the orgasm part, which is the last stage of, third stage of a sexual cycle, attaining orgasm, and after this, the resolution happens. So, females, it is said that females most of the time they fake orgasm. They are not actually getting orgasm, because males का तो पता चल जाता है, they release, and everyone, it's sure that they have reached to the peak. But females, they lack in achieving orgasm, and they do not share it with even their partners also. So we have treatment for that. As I told, that orgasm in female comes from clitoris or vagina. So if you are having problems in attaining orgasm, we can definitely give you treatment options for that. So what are the, like as sex is a complete, exercise in itself, and even if you are having a regular sex but you are not achieving orgasm, you are getting deprived of the benefit of sex. So what will happen if you will not achieve orgasm even after doing a sexual activity? You will suffer from pelvic pain and discomfort. There will be a, because you are not releasing, so feeling of depression, and it happens because of the hormone serotonin. And it becomes a vicious cycle. आपको orgasm नहीं आया है तो next time आपका definitely उतना mood भी नहीं बनेगा, so आपकी sexual desire भी कम होती जाएगी. And because you are not getting benefited completely, मतलब जो एक पूरा एक्सरसाइज का बेनिफिट मिलना चाहिए, जो एक इट इज एंटी एजिंग, सेक्स एंड ऑर्गेज्म अगर आपको पूरी साइकिल में हो रहा है तो इट इज कंसिडर्ड टू बी एंटी एजिंग, तो यू विल डेफिनेटली बी डिप्राइव्ड ऑफ दैट पर्टिकुलर बेनिफिट ऑफ सेक्स. सो आप ह्यूमन ग्रोथ हार्मोन जो आना चाहिए, जो रिलीज होना चाहिए, वो नहीं होगा, तो यू लुक ओल्डर. एंड उसके इफेक्ट्स क्या है? सर्कुलेशन अफेक्ट होगा, बिकॉज उस एरिया में उतना ब्लड फ्लो नहीं जाएगा, बिकॉज यू आर नॉट रिलीजिंग, और सेक्स उतना अच्छे से नहीं हो पा रहा है, तो देयर विल बी ड्राइनेस, एंड नेक्स्ट टाइम इट विल बी अ पेनफुल इंटरकॉर्स. Then because oxytocin is not getting released properly, you'll have sleep issues. जो एक better sleep अच्छे सेक्स के बाद होनी चाहिए, वो नहीं होगी. So you'll have depression, you'll have loss of sleep, and emotionally and physically आप frustrate हो गए. So treatment इसका कैसे होता है? We counsel the patient, and even, I mean, the both the partners did come to us. We do a counseling session. We try to go to the root cause. Where is the problem and why this is happening? We rule out vaginal or the clitoral causes. Like sometimes labia majora इतने बड़े होते हैं किसी किसी की कि वो इंटरकोर्स के टाइम पे इट गोज इनसाइड, वो फ्रिक्शनली रब करते हैं, फीमेल को पेन होता है. तो अभी तक ये सारे इश्यूज एड्रेस नहीं हो पा रहे थे, बिकॉज ये चीज़ें हमारे रेगुलर गायनी को हमारे एमडी और एमएस के कोर्स में ये नहीं सिखाई जाती हैं. फॉर ऑल दीज ट्रीटमेंट्स यू नीड टू गो टू अ कॉस्मेटिक गायनेकोलॉजिस्ट हु इज वेल ट्रेन्ड from a recognized institute. So now we can, rule out all these causes and can do the treatment. Labiaplasty है, labiaplasty minora है, majora है, orgasm shots है. आपका अगर prepucial fluid तो clitoral fluid reduction हो सकता है. We have orgasm or known as Kama Sutra shots for you, और आपका G spot enhance कर सकते हैं through treatment. So all these treatments can help you in better sex life. Now what is Kama Sutra shot? हम लोग ब्लड लेते हैं आपका, अराउंड 20 ml ब्लड इज टेकन, उसको सेंट्रीफ्यूज किया जाता है मशीन में. एंड वी हैव वन ऑफ द बेस्ट मशीन जिसमें कि टेम्परेचर भी मेंटेन रहता है. इट इज़ रेफ्रिजरेटेड पीआरपी मशीन. उसमें से ये प्लाज्मा लिया जाता है, जो कि 55% ऑफ होल ब्लड है, लीस्ट डेंस कॉम्पोनेंट होता है, ठीक है। और इसको हम लोग पर्टिकुलर एरोजिनस जोन्स होती हैं जो फीमेल्स की, देयर पर्टिकुलर साइट्स जिसमें हम इसको इंजेक्ट करते हैं। एक एक ऑर्गेज्म शॉट का इफेक्ट ऑलमोस्ट 4 to 6 मंथ लास्ट करता है। तो दिस इज वन ऑफ द ट्रीटमेंट ऑप्शन विच इज अवेलेबल फॉर दोज फीमेल्स हु डू नॉट अटेन ऑर्गेज्म ड्यूरिंग इंटरकोर्स। Then vaginal laxity. As I told, most common reason is normal childbirth, aging and all. फिर अभी तक लोगों को लगता ही नहीं था कि इसका कोई ट्रीटमेंट है, बट नाउ यस यू कैन टाइटन योर वजाइना। अगर आप अर्ली स्टेज में प्रेजेंट करते हो तो आप सर्जरी से भी बच सकते हो। एंड वी डू चेकअप examination of female who has come to us with vaginal laxity. Depending on the grades of vaginal laxity, whether it's mild, moderate or severe, treatment option can be offered to a female, and she can definitely have a better sex life. Because again, this is the repetition: childbirth, aging, vaginal trauma or certain genetic disorders also lead to vaginal laxity. Since क्या होगा कि sensation loss हो जाएगा, she will not be able to feel the male part and मेल जेनिटेलिया प्रॉपरली, तो वो फील ही नहीं आएगा इंटरकोर्स के टाइम पे, सेक्सुअल सेटिस्फेक्शन नहीं होगा। एंड ऑल्सो नॉर्मल डिलीवरी में पेशेंट में स्ट्रेस यूरिनरी इनकॉन्टिनेंस ऑल्सो हैपन, बिकॉज वेन एवर बेबी कम्स आउट ऑफ योर pelvis there is damage of nerves and muscles. Then treatment, again exercise, medication, but that is not of much help. Early stages we have electromagnetic stimulator, laser और radio frequency modality. if किसी को बहुत severe vaginal laxity है तो surgery is the option for her. You can see in the last box, see this is was her vaginal laxity before the treatment, this is after the treatment. So this is like one of the probe for you can say laser or RF. This is how it goes inside, and this is the heat based treatment. And there is formation of new collagen. Collagen is main building part of our skin and muscles. So new collagen होगा, नए fibromuscular tissue बनेगा, and female can regain her vaginal toning. वो tightness and toning हो जाएगी, तो it will help her in a better sex life. Then coming to vaginal dryness, पूरे like this is showing कि एकदम ऐसा लगता है जैसे कांटे चुभ रहे हैं. So after ruling out causes for that, it happens more in breastfeeding mothers and in old age patients, leads to painful intercourse. Almost 1/3 of women suffer from vaginal dryness. We can give hormonal supplements and RF and laser, because there is new tissue formation. So जो भी नया टिश्यू बनेगा वो हेल्दी बनेगा एंड vaginal dryness की कंप्लेंट कम हो जाएगी. Again coming to bulky labia majora and long propical folds, पहले ये सारी प्रॉब्लम्स एड्रेस नहीं हो पाती थी. दिस लॉन्ग लेबिया मेजोरा और माइनोरा जो है, ये एक तो आपकी सेक्सुअल एक्टिविटी को अफेक्ट कर सकते हैं. दूसरा, दो फीमेल्स हु आर फॉन्ड ऑफ वेयरिंग टाइट क्लोथ्स लाइक टाइट जीन्स या ऐसे कुछ पहनना है, इवन साइकिलिंग के टाइम पे ये प्रॉब्लम कर सकते हैं, पेन हो सकता है. तो नाउ these all problems can be dealt with. किसी को बहुत ज़्यादा नहीं है, थोड़ा कम है, तो we can deal it with radio frequency और laser machines. But किसी का बहुत ज़्यादा है तो definitely she need a surgical correction for this. Again same clitoral hood. किसी का ये जो clitoris होता है females का, उसके ऊपर एक skin होती है, उसे clitoral hood बोलते हैं. किसी का वो इतना बड़ा होता है that it completely covers the clitoris. So surgery is the only option for that. We can do a clitoral hood reduction, or this is also known as hoodoplasty. उससे because उससे chances of orgasm कम हो जाते हैं, so definitely patient को surgery के बाद फिर help होती है. So what a cosmetic gynecologist can do, we have we do counseling of the patient, which is a very important part. Then we have these three modalities in our armamentarium. Besides counseling, we have non-surgical options, we have surgical options for you. Non-surgical options में vaginal rejuvenation, मतलब किसी को कोई भी प्रॉब्लम है एक्सटर्नली vaginally also and even externally, किसी का लेबिया मेजोरा माइनोरा सैग कर रहा है, या कोई भी प्रॉब्लम है, सो वी हैव नॉन सर्जिकल ट्रीटमेंट फॉर दैट थ्रू our modalities, which are heat based devices, so you can rejuvenate your vagina and your external genitalia appearance also looks much better. Vaginal tightening, we have orgasm shots for you known as Kama Sutra shots for patients with stress urinary incontinence. Again, if it is in early stage, हम आपको ऑफर करते हैं नॉन सर्जिकल ऑप्शंस. अगर किसी को बहुत सीवियर है तो वी हैव टू गो फॉर अ सर्जरी एंड पोस्टमार्टम मेकओवर. अगेन आई मीन इसमें सारी वही ऑप्शंस आती हैं आपकी. मैम देयर इज अ स्कोप ऑफ कॉस्मेटिक गायनी इन कॉस्मेटिक things also, you know, changing the look of your external genitalia to stretch marks and all. So postpartum makeover starts with your pelvic floor strengthening, basically postpartum rehabilitation. So these all things can be done by a cosmetic gynecologist. So this is like one of the radio frequency machine available with us. It is one of the most advanced radio frequency unit. It is better than laser. It enhances sensation in the vagina. It takes care of incontinence issues by strengthening the vaginal support system, the pelvic floor muscle system. It has almost nil downtime. Nil downtime is like after a surgery जब आपको rest बोलते हैं कि आप जैसे suppose किसी की surgery हुई है कि आपको अभी इंटरकोर्स नहीं करना है, तो दैट मीन्स फॉर अ पर्टिकुलर मोडालिटी ऑफ ट्रीटमेंट यू हैव अ डाउन टाइम. जैसे लेजर में 7 days आपको इंटरकोर्स नहीं करना होता है आफ्टर योर लेजर ट्रीटमेंट, बट फॉर रेडियो फ्रिक्वेंसी मशीन देयर इज नील डाउन टाइम. आप सेम डे सेम टाइम पे जाके इंटरकोर्स कर सकते हो एज इट इज नॉन सर्जिकल एंड नॉन इन्वेजिव. It eliminates vaginal and labial dryness. So we can deal vaginal dryness also with this machine. It prevents and treats pelvic prolapse by strengthening muscles. ये अर्ली स्टेज में अगर किसी का सिस्टोसील है, रेक्टोसील है, या थोड़ा सा भी यूट्रस अगर हल्का डिसेंट है, तो दिस कैन ऑल बी डेल्ट बाय दिस मशीन वेरी नाइसली. एंड इट हेल्प्स यू टू गेट बेटर orgasm ड्यूरिंग सेक्स बिकॉज आपका न्यूरोमस्कुलर जो बंडल है वो एक्टिवेट हो जाता है, आपका वजाइना टाइट हो जाता है, तो डेफिनेटली यू विल गेट बेटर orgasm. It tightens the vagina for better sex. This is the electromagnetic stimulator which works on HIFM technology, and it also one of the advanced pelvic stimulator from Korea. It utilizes high intensity focus electromagnetic technology HIFM to cause deep pelvic floor muscle stimulation and restoration of the neuromuscular control. अब इसमें जैसे किसी को कीगल बोले, कीगल दिन में 3-4 बार करो, आप कितनी देर कर सकते हो? 2-4 मिनट. ये 20 मिनट के सेशन में आपको 1000 ऑफ कीगल एक्सरसाइज करवा देता है. एंड इट इज टू बी डन 2 to 3 times in a week depending on the severity, and it is safe, well tolerated. You don't need to remove your clothes. You just come, you remove your any magnetic metallic element if you have on your body, phone to be kept away, and you just come, sit and go. 20 minutes session. It is safe, well tolerated, and effective for treatment of mild and moderate urinary incontinence. For severe, as I already told, you definitely have to undergo surgical option. Recommended for patients with mild to moderate incontinence. For postpartum rehabilitation, it is one of the best modality and early symptoms of prolapse. Now, this is the PRP machine, which is refrigerated. So, because platelets are very temperature sensitive, being refrigerated, it will give you the best quality of PRP for orgasm shots, and even for vaginal dryness. Also, we use PRP. So, surgical options again, like whatever problems I already mentioned, those who have severe symptoms, they can go for surgical procedures. Labiaplasty is done surgically. There is no option non-surgical. Similarly, hudoplasty, clitoral hood reduction, there is no option for a non-surgical treatment. Perineoplasty is also done surgically. Perineoplasty is like patient जिसकी डिलीवरी हुई है और बाहर बहुत कट फट गया है, तो पेरिनियम जो पेरिनियल बॉडी होती है, एक स्ट्रक्चर होता है विच सपोर्ट्स द पेरिनियम, मतलब कि वो वजाइना को प्रोलैप्स नहीं होने देता. इफ पेरिनियल बॉडी हैज torn, you need a perineoplasty or a perineal body reconstruction. ये दिस इज समथिंग लाइक थोड़ा सा रिवीजन होगा. I'll go through these slides. The unmet needs of sexual satisfaction, how a trained cosmetic gynae can help a woman. सो अनमेट नीड्स एज अ कंसेप्ट हम यूज करते हैं वीमेन की फर्टिलिटी प्रेफरेंस और कॉन्ट्रासेप्टिव यूज में, बट नाउ डेज वी हैव सो मैनी टाइप्स ऑफ अनमेट नीड्स, लाइक अनमेट सोशल नीड्स, अनमेट sexual needs, unmet these things. And women's sexuality is multifaceted, complicated है. Sexual dysfunction affects about 30 to 40% of women. और women को किसी भी stage of life में प्रॉब्लम कर सकता है, किसी भी फॉर्म में. सेक्स की जो साइकिल होती है, देयर आर 4 पार्ट्स, उसमें भी किसी कोई भी पार्ट अफेक्ट हो सकता है. So sexual activity, as I already told, quality matters, quantity does not matter. So, how to proceed? Like, talk about it. Communication with partner first is the key. Then tell your partner what can be done to make sex more satisfying. Male partners dissatisfaction in sexual act because of losing a vagina and all. I mean, they can discuss, and then they can discuss the treatment option also. Discuss about it and take a cause and opinion to help resolve the issue. And remember that both partners should agree to whatever sexual activity takes place. So consent होना बहुत ज़रूरी है दोनों पार्टनर्स का. एंड टॉक टू अ प्रोफेशनल. लॉट्स ऑफ कपल फेस प्रॉब्लम लाइक टॉकिंग अबाउट सेक्स एंड रिलेशनशिप, स्पेशली फीमेल्स, बिकॉज ऑफ सोशल टैबूज, prejudices, negative social media image of sexuality, and fear of being judged by even their partner. So the role of cosmetic gynae is indispensable, as she is well trained to deal with functional aspects of sexuality. After proper counseling and checkup, root cause can be identified and issues can be resolved. This is the same thing which we already discussed. We have non-surgical, surgical options, and we do counseling. Then again, the same things. So coming to the conclusion, most of the sexual issues were considered to be psychological, as physical factors were not being dealt properly because of lack of awareness. As I told, when we were taught during our MD or MS courses, we never knew that, all this, the labia minora enlargement or bulky prepucial folds, we never used to notice even. So being a cosmetic gynae, we came to know this, these are the real issues. Even urinary incontinence is so much that every second or third patient, like when we ask history, they tell us that that's we leak urine. Even young patients also, 35-40 years of age, that whenever I go to gym, मैं थोड़ा सा भी स्ट्रेस करती हूँ तो यूरिन लीक होता है. So you have to come out of your shell and discuss openly with your gynecologist, and definitely she will refer you to a cosmetic gynecologist who is dealing with all these problems. Now, cosmetic gynecologists are being taught how to deal with certain physical factors which were not being addressed by a gynecologist till date. Non-surgical modalities like laser, radio frequency, these are heat-based devices. Then we have electromagnetic stimulator. They are proving their worth in mild to moderate cases of vaginal laxity and incontinence, along with promising results in cases of vaginal dryness also. And for severe cases, as I told, we have surgical options. Patient can opt for surgical option if the severity is very high. Thank you, everyone. Thank you for your patient hearing. So, Nikita, do we have questions? Nikita, do we
No,
have
we don't have
questions?
any. No, we don't have any questions, ma'am. But people are saying thank you to us for the amazing session. So thank you and have a nice day.
So we're done.
Yes, ma'am. Yes, we are done.